Assalamualaikum. In this video we are going to start the chapter 11 of the therapeutic exercises books. The chapter name is Joint, Connective Tissue and Bone Disorder and Management. First of all, we will start with the degenerative disease arthritis. Arthritis is, the inflammation of joint. Arthritis can be osteoarthritis or rheumatoid arthritis. Here we will see the difference between both osteoarthritis and the rheumatoid arthritis. I hope you can see it clearly on the book. This is table 11.1 of the chapter 11 of therapeutic exercise books. If I talk about the characteristic of between both osteoarthritis and the rheumatoid arthritis is, first of all, age of onset. In osteoarthritis patients, usually after the age of 40 or the late adulthood, when a person is about to start his adult life. Well, in contrast, rheumatoid arthritis, it can start from age 15 and 50. Osteoarthritis usually comes in elder age, while rheumatoid arthritis can come in early age too. The next is progression, that how it worsens with the time. Osteoarthritis usually develops slowly or gradually. It is a long process or time taking and it gradually worsens. In contrast, rheumatoid arthritis, it can be sudden within weeks or months. Manifestations, as we know that osteoarthritis and rheumatoid arthritis both are degenerative disease, and whenever we study degenerative disease, cartilage degradation, altered joint architecture and osteophyte formation. The osteophyte is the bony projections on the bone. For example, your knee joint is affected, then there will be bony projection or extra spurs on the bone that will lead to osteophyte formation that can cause irritation. In rheumatoid arthritis, inflammatory synovitis. What is synovitis? It is the inflammation of the synovial fluid of a joint and irreversible structural damage to cartilage and bone. Joint involvement in osteoarthritis. This is distal interphalangeal, proximal interphalangeal, first carpometacarpal, cervical, hip, knee, first metatarsophalangeal. While in rheumatoid arthritis, all the small joints are involved, like MCP, PIP, cervical spine, ankle, like the smaller joints. And if we talk about the symptom of osteoarthritis, then it is morning stiffness. Morning stiffness less than 30 minutes. It is not long. While in contrast, rheumatoid arthritis, morning stiffness is long-lasting and prolonging morning stiffness with the redness, warm swelling and the sign of inflammation. Systemic sign, there is no systemic sign of in osteoarthritis, while in rheumatoid arthritis, some anorexia or sickness, morning sickness, fatigue or fever you can see, and some involvement of respiratory, hematological and cardiac signs. Well, there are blood disorders sometimes. So this was all about the comparison of osteoarthritis and rheumatoid arthritis. Thank you.